But tonight is going to be very full. There's a lot of information here because chronic pain is a huge, huge topic. We could make an all-day conference out of chronic pain and treatments. But I did want to go, I do want to touch on some of the issues behind what causes chronic pain. But I really want you to gather some tools that you'll be able to use tonight or tomorrow morning, because I think that that is how we're able to empower ourselves to make really good decisions for what's best for us. And then also take information perhaps back to our physical therapists, chiropractors, pain management physicians, general practitioners, so that we can, again, make really good decisions for ourselves. I will mention some products as well as we get going through here. And certainly if you need any help with navigating what those are or where to find them, again, let me know and we're happy to go. So let's get started. We're going to have a lot to go through tonight. Let me click here. So I own Makers Compounding Pharmacy. We have a Hallmark store as well. I'm an international LDN consultant, and there is a big conference coming up first weekend of June. I'm also an A4M fellow candidate, as is Natasha, who works for us at Makers Compounding Pharmacy. So what I find very interesting is that over 30% of all Americans are affected by chronic pain, not necessarily acute pain, but chronic pain. And quite honestly, it's the number one reason why people go to the doctor is because of some type of pain, usually an arthritis-based pain. But what is it? So it's basically inflammation of the central nervous system. Even though your big toe on your left foot might be the one that's hurting so badly because maybe you broke it or you stumbled upon it at some point in time, it actually is the inflammation that travels back up that nerve, possibly up the spine, and registers elsewhere in the brain. Now, the brain is made up of little cells, and they're called microglia, and we're going to talk a little bit about that. But when we have a little bit of inflammation, that can actually be helpful because that is the signal to certain chemicals and certain cells in our body to rush in and try to repair. And that's really important. But when that inflammation goes on for longer than what the body feels is necessary, usually more than a week or so, that then is deemed as chronic inflammation, and that can lead to other issues and certainly can lead to a decreased quality of life. So eventually this will actually change the way the nerves function. It could possibly cause nerves to die or nerves to signal improperly. So when we look at nerve pain, if we look at chronic pain, if we look at inflammation of tissues, we need to take a look at your wellness profile. So what exactly does that mean? Well, when we talk to people about pain, we need to encompass your entire being. So it's not just what you did to your big toe that given moment, but really other pieces of your life as well. How do you live? How do you work? What do you do for fun and enjoyment? But it's also how do you deal with stress? What do you eat? What do you drink? And do you take vitamins or supplements, or what other medications do you take? Because prescription medications are entities that are supposed to help us. But in some cases, some medications can actually deplete our bodies of very specific nutrients that can then be associated with chronic pain and can make it worse. So this is great information, but where do you go with this, right? So first of all, I want you to hear you're not alone and you can get through this. It is very important to evaluate what is going to be best for you so that you can make decisions for yourself. But there are a lot of people in your corner There's a lot of people that are available to hold your hand through this process and guide you. Because as you well know, you've probably had these issues for a long time, maybe years and maybe even decades. Perhaps you have seen several physicians, several physical therapists, several chiropractors, several prescribers, and you still have the same laundry list of issues. So that doesn't mean that there's no hope, even though sometimes that's what it feels like when you go to the doctor. It's like, well, I don't know what to do for you. There are things that you can do. So let's talk a little bit about those. When we look at emotional wellness, because we know that pain can weigh very heavy on our mood, it can literally change our personality profile. It can decrease our overall health, and it can impact our work life, our family life, and it can change our body. So for example, if you hurt your big toe, you might actually start feeling pain in your lower right back because maybe you're overcompensating, right? So you're trying to keep the weight off of that big toe because it hurts every time you step. So maybe now your right side of your body is starting to hurt. Well, that can make us really grumpy, and that can affect everybody else around us, and it can affect what's going on in our lives. So here's going to be a little bit of the sciencey stuff. And we're going to try to go through it fairly quickly. But the reason why it's important is because not all chronic pain is due to an injury. Chronic pain can be caused from a wide variety of issues, whether it's an autoimmune condition like fibromyalgia, MS, chronic fatigue. It could also be caused from a viral infection like Epstein-Barr, Lyme disease. It can be from an environmental toxin, heavy metals, even food preservatives and dyes. Many times these are insensitivities or even allergies that we have that we may not necessarily be associating with our underlying issues. Traumatic brain injury can be caused from literally a car accident, a sports injury, even somebody smacking their head. Maybe they passed out and they hit their head on the concrete. All of that can be very important. And that can definitely cause issues throughout the entire body, not just in one area. But anytime that we see nerves, which are those pathways that conduct electricity or messages from one area of the body to the next, anytime that those are not as healthy as they once were, that's when we speed up aging. That's when stress plays even a more important role and can also lead to things like hormonal imbalance. So microglia are those fun little cells in our makes up more than 80% of our brain, therefore conducts not only what happens with blood supply, but messages and sends oxygen elsewhere as well. Because if you've had an issue with your big toe for a really long period of time, maybe it's not the same color, maybe it's purple now, maybe that nail bed is not as healthy as it once was, and maybe it tingles, right? So all of those things can be traced back up to what's going on in the brain. We can see a wide variety of other issues. And sometimes when we have pain over years, it can compound some of the other diseases or illnesses that we associate with aging, such as Alzheimer's or Parkinson's, even MS. And that doesn't mean that you have to then just kind of go, oh, well, that's just part of getting older. You don't have to necessarily accept it for that, because there are things that you can do to help improve those pictures and improve your quality of life. What neurogenesis means is the repair and the rebuilding of an adult brain. And there are things that you can do, such as meditation, quietness, mindfulness can decrease stress. Anytime we decrease stress, we can decrease inflammation, not just in our brain, but throughout our body. And with that, when we decrease stress, we actually feel less pain, which is lovely. It sends out different chemicals in our body and actually sends out different hormones in our body to help lower lower the amount of pain, but it also increases our pain threshold, which means we don't feel pain as quickly. Now, the other part of stress is sleep is very, very important, but it's also really important to look metabolically as what's going on with our stress level. And what I mean by that is perhaps it's not just a physical injury, but a mental worry, or perhaps it's a dietary issue. So some adult onset diabetes, for example, can actually increase pain, because anytime you have a higher blood glucose level, you've got more sugar running around in your blood, then that actually can cause more pain. So it's important to keep that under control as well. Lots of triggers for pain. Again, could be lack of sleep. I think all of us have had issues with missing sleep for a day or two or three because we've had stressful events or we're in a different environment. And when you don't sleep well, you know that the next day is not going to be stellar, right? We may not be performing at our highest level or highest aptitudes. We may actually eat things or drink things that get us to kind of move and try to clear out that fog and pull the drapes back so that we can be as bright and shiny as possible, but that doesn't always help. And we know that there are some medications that deplete very specific nutrients in our body, which can allow us to have more pain. That's really important. But a few things that we're going to touch on next are specific to what's going on in our gut, because food and water in changes what happens in our intestinal tract, can change what's happening in our brain, which can then change how we feel and feel pain. It's a lot of information, isn't it? There's a lot. So there are some supplements, lifestyle changes, and also testing options that can help you. The standard American diet, SAD, SAD, truly is that. Because what we're missing in the way we grow our crops are some of the very vital nutrients that are no longer in our soils, therefore no longer in our plants, therefore no longer in our tummies when we eat them. So you have to use vitamins and supplements to put those back. You know, our gut produces 70% or more of all the immune factors necessary to keep your whole body as immune powerful as possible. So anytime we're going to enhance our immune system, modulate your immune system, we've got to pay attention to what's going on in our digestive tract. 90% of serotonin is made in the gut. Serotonin is our happy hormone. So if you're not happy, if you're in pain, even if you're just going through menopause or andropause, a lot of times we're just not feeling as happy as we once were. So a lot of times the doctors will just write prescription for an antidepressant, right? Well, most of those antidepressants actually keep serotonin in our body. And a lot of times it has nothing to do with what's going on here, but what's really going on in our stomachs. So our gut actually makes brain fuel. So again, if your gut isn't healthy, you won't be happy. If your gut isn't happy and healthy, you will actually feel pain sooner and for longer periods of time. There are several studies that I mention here because we do have physicians on the call tonight. So this is a really great book. It's called Grain Brain, and it talks about how the standard American diet truly connects issues with chronic pain. And I think if you change your diet, even just for 7 days, where you ate clean proteins that were about the size of your palm, and then you ate at least 5 vegetables, decent size servings, and they don't come out of a can. Nothing comes out of a can. Everything is fresh. You can make an enormous impact. Just 7 days, literally 7 days, you can change a lot of things. You can change how you feel about pain. You can change your blood glucose level. You can actually peel away that fog and feel brighter and more connected to people. 7 days, literally, it's amazing. if you don't have a healthy gut, you're not going to absorb things very well. And you might not even be absorbing your vitamins, your supplements, but maybe not even your medications very well. So for example, I've been a pharmacist for 34 years. And when I was primarily working retail, it was very common that people would come in and they'd say, I was taking this medication for a while and I don't know what's going on now, but it's not working. I go to the doctor, my blood pressure's up, my cholesterol's up. I'm just really lethargic. I feel slow. I feel sluggish. I don't think my thyroid medication's working very well, and I'm not sleeping. What is going on? So then I ask a lot of questions, and we can narrow it down to usually something going on in the gut. So for example, do you feel gassy? Do you burp? Do you have reflux? Do you feel bloated? So does your tummy actually distend when you eat things? And perhaps you've got allergies and intolerances that you may not be aware of. Sometimes that can cause migraines even. All of this could be associated with mood changes. Anytime we're not absorbing very well, it allows byproducts and toxins to leak out through the gut and then land in our head, in our brain, or even on our skin. So again, super important that we take care of our gut. It really is the second brain. I mean, it's crazy. But it's also when we're picking out vitamins and supplements and even picking out foods, it's important to know, should you be using activated vitamins? And what that means is, are they ready for your body to absorb, or will your body already change them into the active forms? You can't tell by just kind of, looking at somebody that, oh, wait, yeah, you activate fine. You actually methylate your vitamins and supplements, no problem. But you over there, maybe not so much. You can't tell by looking at someone. But what we can do is we can test. As we get older, our gut slows down, things change in our digestive system, as everybody well knows. Sometimes we have bouts of diarrhea, sometimes we have bouts of constipation. We just don't absorb as well. And of course, as we get older, kind of like paint on a car, right? If you leave a car out in the weather all the time, eventually the paint tends to oxidize, right? It's not as shiny and vibrant as it once was when it came off the showroom floor. It's now kind of dull. Maybe it's got some changes and some sunspots, or maybe it's flaking or peeling, or maybe you've got some rust going on around the wheel well kind of thing. Well, that happens in our gut as well. So we can take a look at what's going on in our gut and improve that. And what I have found, and I know that it's like, wait a minute, Michelle, we were talking about pain. How come we're talking about this? What I have found is that when we can actually address the issues in the digestive system, people actually feel less pain. Even if they had an injury that caused significant changes to their back, or they broke their big toe, a lot of things that we can do kind of off to the side can have a dramatic impact. When you're looking for vitamins and supplements, very important to pay for good professional products, because you don't want to have just expensive pee. You want to be able to get the biggest bang for your buck. Always pay attention to your I totally lost the word. Totally pay attention to your budget. We're not asking you to spend, $1,000 a month on supplements, but we need to have a chat as to what's going to be best for you. Magnesium is one of my most favorite things of all. Magnesium in the right form can decrease inflammation, can decrease blood glucose levels, can always help with pain. In all of those situations, we're going to see better benefit. Magnesium glycinate is my favorite type of magnesium. So I'm sure that was going to be one of the next questions. And the reason why I like magnesium glycinate is because the glycinate part comes off and it actually soothes the lining of the stomach, and then magnesium can be better absorbed. So when we're talking about supporting joints You know, a lot of people say, oh, when I walk on bone, I've lost that protective covering. Collagen can help with that. Some people talk about, you know, they've got rotator cuff issues and they're really hurting. Again, collagen can help with muscle issues as well. And this is one of my favorite brands. Digestive enzymes are important because not only do they reduce inflammation in the gut, those are the same enzymes that help to decrease pain elsewhere in your joints and your muscle fibers. They also help to build the immune response in your body. If you want to know whether or not certain vitamins are good for you or certain types of vitamins are best, we could always test. Micronutrient testing is very easy. It's a simple blood draw. When we don't have enough magnesium, we have issues with our heart in our blood vessels. If you don't have enough B6, you can be sleepy and groggy and foggy. And you can have decreased minerals in your body that will then not allow your thyroid to function very well either. So if you're curious about these things, and sometimes these are subtle issues that happen over years and years and years, but with micronutrient testing, we can actually find out what is going on and get to the root issues. We can also look to see how genetically you associate exercise as well as brain health and gut health, organ health, because all of these are components to how your body is going to age and what condition is it in now so that you can make better choices for yourself for later. Toni Marthaler does, she's a genetics specialist. She is a provider in Green Bank, but she also provides 3x4, 3x4 genetics. This testing is amazing. It has 36 core insights that allow you to make better choices. What I found with this is that specifically in my husband, he's had chronic low back pain for a long time. We corrected his testosterone level and his pain went away. You could also look to increase blood flow and decrease impingement on nerves and muscles by using osteopathic medicine manipulation and chiropractic care, as well as physical therapy, massage, and yoga. So yoga is something you can actually do at home. There are some amazing videos out there on YouTube. There's so many free ones. It's crazy. It's so easy. You don't have to be 120 pounds and svelte to actually move your body. You don't have to do the exercises exactly how she shows you. If your body does not move very well because you've been in pain for a long period of time, there are certain yoga techniques and small movements that you can do, and you can slowly build up to moving your body more freely. But what I will say is that if you stop moving, you will just see a quicker decline. You got to move it, because if you don't move it, the blood doesn't flow. And if you don't move it, you get colder and your nerves tend to break down, your muscle fibers break down, your bones will break down. So specifically, when we're addressing pain, a lot of people think that they go to the doctor, they get a prescription for, something for muscle spasms, inflammation, and maybe a pain medication like tramadol or oxycodone, hydrocodone, things like that. Well, when you take those medications, a lot of times they can make you very sleepy. They can give you a very dry mouth, very dry eyes, dry skin. Sometimes they make you kind of woozy, so that when you go from a sitting position to a standing position, you get kind of lightheaded. Well, we can take a lot of those medications, maybe even gabapentin, amitriptyline, which those two medications are used for nerve pain a lot. We can actually put those in creams that go through the skin and get to the area inside where the nerve is being pinched. So that's how you perceive pain. So dermatome is an area where the nerves come out from the spinal column and where they actually end up and innervate. So I apologize, this is a male figure. I couldn't find a female dermatome for the life of me. Sexist is all get out, but whatever. So when we look at the spine directly, we can see that at the very top, back in the back of the neck, those nerves will branch out from in between the vertebrae and primarily innervate the head and the upper shoulders. And then when you get into the thoracic, which are the T numbers, and that goes all the way down to about your hip level. And then you've got lumbar, and then you've got sacral. Well, lumbar are between kind of right around your belly button, but in the back, right? And so those nerves come out and then those go down your legs. So when people say they have a lot of sciatica, they have a lot of nerve pain, which then causes neuralgia down their leg and into their feet, and they get tingling. And sometimes even when they walk, they feel that tingle. Sometimes that can actually be a pinch right at where the vertebrae come together. So where the spinal column comes down and then the nerves branch out between the vertebrae. If those are compressing, that's going to pinch on the nerves and that's going to cause pain. And you don't necessarily feel the pain in your back, but you feel it maybe in your bum or down parts of your leg. So that's why I put this slide in there, is so that you can really see where some of that can happen. And a lot of times with transdermal compounded pain creams and gels, we can combine an anti-inflammatory or two, like ketoprofen, piroxicam, ibuprofen, diclofenac. We can put that in with the muscle relaxers and the nerve pain medications, and we could put it all into one cream. So you literally take your pump and you squish the volume out, and that's where you rub. And you take that amount and you rub it right around the back where the nerve is, but then also where you actually feel the pain. The cool thing about these transdermal medications is that they don't necessarily then become absorbed throughout your whole body. So not necessarily head to toe, but right around that area, if you apply it to, let's say, your big toe and your foot, it would actually transfer up your foot a little bit. So it will decrease inflammation around there too, and decrease the amount of pain that you're feeling, so you can actually walk better. But what we also find is that when we apply it to the back area where that nerve originates, we can further decrease inflammation. But with transdermal medications, we don't necessarily see the same side effects. So you may not get drowsy. You may not have that wooziness when you stand up, and you may not get a dry mouth and have constipation and all that. So transdermal medications can be a very effective option. Not available for everybody, but definitely an option. The other thing too is that they can be rubbed in, once a day to 4 times a day. So if you're not feeling as much pain, you just don't use it. Whereas with oral medications, if you don't have them on board, they're not going to work. Still important to balance our estrogen, progesterone, and testosterone, mainly because estrogen can change the way the brain actually perceives pain. There's a lot of estrogen receptors throughout our entire body, including our gut. Progesterone is actually neuroprotective. Estrogen is neuroprotective, so it can actually protect those nerves and keep them nice and healthy. Progesterone is also a relaxant. It calms us. It helps us to relax so that we can get to sleep and stay asleep, for example. Testosterone helps with immune issues. So all of these hormones are really important. And that's why as we get older and our hormones have tanked and we haven't replaced them necessarily, we tend to have more chronic issues, more chronic disease states and illnesses that can be decreased or even possibly eliminated just because of that. And as I said earlier, sleep is so important. We all, everybody's had those situations where you just haven't slept very well, and the next day you're just not 100%. And a lot of times, if you're not sleeping very well, you hurt more. But a lot of times, if you're hurting, you're not going to sleep well too. So it's kind of that vicious circle. But you can break out of that cycle. And there's several things that you can do. Now, a lot of people are prescribed trazodone to help them sleep, or a tricyclic antidepressant like amitriptyline, because we know that the side effects of that cause drowsiness. There's a lot of other side effects that cause that, cause other issues too, like dry mouth and dry skin. Some people rely on diphenhydramine or Benadryl, which is an allergy medication. And that medication is not necessarily very safe to use in people over 60, because it has so many other side effects. The drug can stick around in your body longer. It can cause your blood pressure to drop. So you can, may even make you drowsy and therefore woozy and lightheaded when you stand up or get out of bed. But a lot of people do use that. I mean, it's in quite a few nighttime sleep remedies that you get at Costco or Walgreens or whatever. But that, just because they're over the counter, doesn't mean that they're necessarily safe for everybody at all times. Some of the over-the-counter prescription, or even some of the prescription medications that we use for sleep, can interact with other medications. So we have to be careful with that. And again, I love magnesium glycinate. It's available in tablets and capsules, helps the gut. Magnesium also helps us to relax so that we can get to sleep. One of the other products that we love to compound is Lowdose Naltrexone. We add a little oxytocin, some melatonin, night-night. It's just awesome. Helps us to relax and sleep so we get better quality of sleep too. So getting back to the hormones a little bit, estrogen protects nerves. It is a natural antioxidant. It helps with dexterity, and it turns on progesterone receptors so that we can be calmer. It also increases oxygen flow throughout our body and increases blood flow as well. Progesterone is very soothing and calming. It also helps to protect the coating or the myelin sheath around our nerves, especially the nerves that leave the spinal column and travel out throughout our body. Very, very important. Progesterone is also known to help slow down memory decline. It helps to build bone. It helps reduce migraines associated with menstrual cycles. It enhances libido, it enhances hair growth, and it decreases depression and anxiety, irritability, and nervousness, which again are 4 of the biggest secondary issues associated with chronic pain. Because if you've been in pain for a long time, you're going to feel depressed. You're going to feel anxiety and irritability, and a lot of times nervous as well. And most of the time, you may be on a long time pain medication, something for sleep. You're probably also on an antidepressant. Testosterone is one of those hormones that we just don't give it as much playtime. Men have more testosterone than women do, which is fine and dandy. By the way, men have estrogen and progesterone too. So we need to measure those and correct. And again, I do believe we need to be testing more frequently. And professionally, I don't like to test hormones in blood. I don't think it gives us a very clear snapshot, because it's kind of like hormones are put on these carrier molecules and they're raced up our bloodstream so that they can land in the target tissues, which is kind of like traveling on the freeway so you can get home. Well, you don't live on the freeway. You live in your house and you park your car in the garage. So the hormones get parked inside the cells. They don't necessarily, their primary activity is not necessarily up and down the blood vessel in the blood supply. But when we can measure what's actually happening inside the cell, we get a better picture. And therefore, we can only replace what's necessary. So that if you're not deficient in testosterone, there's no sense in giving it to you. We also know that when you're chronically in pain or even acutely in pain, your libido is shot. You don't necessarily feel like being amorous or intimate. That can play a huge role with relationships. It can also play a lot of role and a very tragic role in how we actually feel about ourselves. So very important. And testosterone, as well as the other hormones, can be associated with brightening that area. One of my favorite medications to use is low-dose naltrexone. It is a low-dose medication. It has low side effects. It's very low risk. It has a low price. It is compounded. We use low-dose naltrexone for a wide variety of issues, but you'll notice that arthritis and joint pain, along with a wide variety of other issues. So when we specifically talk about arthritis and joint pain, we're talking about all the arthritises: osteo, rheumatoid, psoriatic, degenerative. But when we're dealing with joint pain, it can also not necessarily just be for when the outer coating is missing, but it could also be the inflammation that is associated because maybe you are eating a food that is depositing harmful toxins in your joints, and that causes pain. We could also use it for a chronic injury like chronic regional pain syndrome. So some people who have been in car accidents, for example, they have an injury to their foot or their lower leg, and that can cause severe pain, and it is intense. And it a lot of times will decrease one's ability to walk and to move. And that will definitely mess with your head and feel very depressed. But we use low-dose naltrexone, and some people actually regain their ability to walk because we've decreased the inflammation. We support them with nutritionals as well, and sometimes they're able to regain their ability to walk even 60 days later, which is really cool. We know a lot about low-dose naltrexone. It was actually founded, it was FDA approved in 1964. But over the last 30 years, we've really been studying the low doses of this drug, and it has very different activity at low doses as it does in high doses. The Dartmouth paper is a peer-reviewed compilation of over 900 published articles, case studies, and it is one of my most favorite articles because what it does is it summarizes everything based on disease state and what the outcome of that study was. So this article is probably one that we hand out the most, especially to practitioners that write prescriptions for low-dose naltrexone. In the last 30 years, we have found that low-dose naltrexone works on very different mechanisms of action. So there are certain pro-inflammatory chemicals that are produced in the body. We've heard a lot about interleukin 6 and 12 since we've heard a lot about COVID. Interleukin 6 is that chemical that is produced by the body to try to kill the COVID area wherever it infects attaches in the lung. And when interleukin 6 escalates, then we usually see a lot more inflammation, which we see fluid coming in, and then we see people dying. So if we can block interleukin 6, interleukin 10, and interleukin 12 with low-dose naltrexone, we see inflammation go down. We see pain go down because now low-dose naltrexone will bind to those same receptors that opiate pain medications do. So we don't want to use those two medications together, right? So if you're on tramadol, oxycodone, morphine, hydromorphone, hydrocodone, we have to separate low-dose naltrexone. It's a fabulous drug. These are just some of the sciencey details on low-dose naltrexone. We've been using it in a wide variety of viral infections for more than 30 years. Dr. Bahari was a triple board certified immunologist, and he was using it in AIDS patients back in the middle 80s. And he found that these individuals who he was actually giving high dose naltrexone to help them with their alcoholism. And they didn't have jobs, so they weren't able to afford their naltrexone. So they were breaking the tablets up, and they were breaking them into quarters or eighths. And in doing that, they actually were getting better. Their immune system was modulating, it was boosting, it was coming up, and they were living longer and they were getting better. So he did a little bit more study on that and literally had an epiphany about 1 o'clock in the morning, as he writes in his journal. And he figured out how it was actually working. And that's been phenomenal. It's literally saved lives. Low-dose naltrexone has saved many, many, many lives worldwide, not just here in the United States. Low-dose naltrexone is titrated to your individual needs. So if you have chronic pain, which we use LDN in low dose, very low dose, and ultra low dose with people with fibromyalgia pain, chronic pain due to gut issues like Crohn's or ulcerative colitis, even for chronic regional pain syndrome because they've had a traumatic injury. We use low-dose naltrexone for traumatic brain injury, somebody that has had several concussions or a major concussion. We use low-dose naltrexone even in situations where someone doesn't know why they are in pain, but they just are. And often we will adjust these doses to find that individual's happy dose, and we can adjust that dose 9, 12 times over a series of a couple of months to really hone in on what's specific for them. We see that this medication helps with the immune system. It helps with nerve inflammation. And it actually changes the way pro-inflammatory chemicals are made in the body. So again, this is the Dartmouth study. If you want a copy of this just ask. We're happy to provide that. We can send it to you electronically. We can give it to you in paper form. It is a compounded medication. We primarily compound it in capsules, sublingual liquids. Troches are little discs that are dissolved under the tongue. We can also put it in transdermal gels. Transdermal gels we use a lot in autism. In very little doses, it works very differently than if we use it in large doses. So if you Google naltrexone, you're going to get information associated with the 50 to 300 milligram dosing parameters, even the Sinclair method, which is looking at helping with alcoholism and opiate addiction, methadone addiction. But when we're dealing with chronic pain, we're going to use very low dose up to low dose. And if we're trying to help someone with their pain, and if they want to get off of their opiates, then we also use ultra low dosing. So we can literally help people get off their pain medications that they've become addicted to at the same time of decreasing the amount of pain that they have. That's phenomenal, but it works, and we've done it. Some of the side effects that people talk about are vivid dreams. Now, a lot of people in pain don't dream very often, but when you start having dreams, that tell us that low-dose naltrexone is working because it helps you to dive down into that area of sleep. It's called REM, rapid eye movement, and that's where we dream. Sometimes if you have issues like post-traumatic stress disorder, we have to be very careful because sometimes those vivid dreams are scary and they can take away from your quality of sleep in that situation. Sometimes we just move your dose to the morning. But a lot of times what we'll do is we'll decrease the dose for a while and then before we move you to the morning. It does so little harm. There are very few drug interactions. We don't want to use it in moderate dosing protocols when you are on an opiate, but we can use it in ultra low dose. Sometimes we dose it twice a day even. I will say that that early on, Dr. Bahari was using dosing parameters. Dr. Zagon was using this as well. He would start people at 1.5 milligram, and then after a week or so, he'd go up to 3 milligram, and then after a week or so, he'd go up to 4.5. We don't use that dosing protocol as much anymore. We usually start super tiny and then slowly increase over 9 to 17 weeks. But again, it's fairly affordable. And we actually built these great titration schedules because Patients need something to follow. They need to know where they're at and what to do. But what you don't want to do is you don't want to take this handful of medications right before you go to bed, because what does that mean? That means you've got to drink a huge glass full of water, which means you're going to have to get up and go to the bathroom, and that decreases your quality of sleep. So we built these titration schedules so that you can actually have like 2 different strengths of medication, and then we teach you how to use some out of here and some out of here depending on what week you're in. And that way you only have to take maybe 1 to 4 capsules. And that's a lot easier to handle at night, because the number one issue that we hear from patients every single day is, what can you do for me so I don't have to take so many medications and so many vitamins? I just don't want to take that many. Well, we can help with that. We also have ways to support our prescribers so that we can field patients' questions and then get information back to the providers. We can also basically hold patients' hands through the process until they find their happy dose, and then even answer their questions after that. So that patient follow-up program allows for patients to be much more successful in developing better pain protocols. We've developed a new website. It's called the LDN Pharmacist. You can find a wide variety of blog posts. You can find information about LDN, ultra low dose, even veterinary applications of low-dose naltrexone there. You can also find all of our seminars there. A couple of other medications I just wanted to quickly mention. So Synapsin is a natural herbal medication that is prescription. We mix it with some B12, and it's actually a nasal spray. And people are like, why are you using a nasal spray for pain? Well, so Synapsin is primarily to reduce inflammation in the brain. So we use it for traumatic brain injury. We use it for executive burnout. But anytime we can reduce inflammation in the brain, we're going to see less pain throughout the body. But the nerve that goes from the nose goes directly to the brain. It's the only one in the whole body that goes directly from one spot to the brain. Every other nerve crosses over someplace before it gets to the spot in the brain where it actually does its work. But then the olfactory nerve, the one that's in your nose, it's the one that goes directly. So this is actually a really cool product. Synapsin is used in the NFL quite often, especially to help with people who have had a lot of head injuries, which, I mean, my gosh, those guys are banging their heads back, during practice. They're banging against each other all day, all game long. And they're doing, I mean, gosh, how many games do they have? 30 some a season? It's just crazy. So it actually decreases inflammation around nerves, and it works like an anti-inflammatory, kind of like, has anybody ever taken Celebrex or some of the newer generation anti-inflammatories? That's what that COX-2 inhibitor is. So it works like that as well. So anytime we can improve nitric oxide, that means we have better oxygen available to blood vessels, to muscle tissue, which makes them brighter and they feel pain less. That actually nourishes those tissues as well. And therefore we have less injury and less damage. It also doesn't allow the nerves to misfire and be really excited. So we mix it with a little bit of B12. It's in a nasal spray. B12 is this bright pink color. So sometimes we have to tell people that you might have red licorice looking snot but yeah, you get kind of these red licorice boogers, which is kind of weird, but that's the color of the drug. It also helps with the methylation process. So you actually enhance your absorption of vitamins, and it decreases some of those chemicals elsewhere in your body that cause even more inflammation in blood vessels and organs. Helps improve cognitive function, decreases depression. So does oxytocin. So oxytocin is that natural hormone that When a woman has a baby and the baby gets put on their chest, it helps them connect with that baby. It helps us to feel calm and attached. It's also the chemical that's released during an orgasm. Men produce a little bit of oxytocin, women produce even more, but it helps to release endorphins. Endorphins are our natural painkillers. So anytime that we can use oxytocin, we can actually see less depression, we see less grief. So we do use oxytocin in a nasal spray for grief issues as well. It does enhance sexual desire. It helps improve orgasms, and it helps protect muscles from aging, and also helps to reduce pain. Now, there's a doctor that I know of that's actually using oxytocin to help decrease GERD, which is that gastro and esophageal reflux syndrome. A lot of people take like Prilosec or omeprazole or Prevacid, which is lansoprazole. So that gas burpy stuff. She is actually recommending oxytocin for that and has seen some dramatic improvement. And it makes sense. It completely makes sense the way it works. My favorite slide, all of our virtual teachers. I just want to put it out there right now that if anybody has any questions, this is a great time to ask. We're happy to answer any questions. This has been a ton of information, and I hope everybody has gotten a little bit of help from this tonight, but I'm certainly happy to answer any questions that you may have.